Okay, let's start. Let me introduce myself. I'm Professor Ian Jones. I'm a psychiatrist, perinatal psychiatrist, and researcher. I'm director of the National Centre for Mental Health and one of the lead investigators for the Bipolar Disorder Research Network study. And I'm absolutely delighted to be chairing this webinar today with some of my most favourite people in the world. So we've got a fantastic treat. This is a webinar on this condition, postpartum psychosis, that is of such importance, and it's in collaboration between the National Centre for Mental Health, Bipolar Disorder Research Network, and Action on Postpartum Psychosis. It's part of the Maternal Mental Health Awareness Week, and I'd really like to thank the Perinatal Mental Health Partnership for promoting and allowing us to be part of this really important week of maternal mental health activity. So with all that in introduction, that's me. I'm going to introduce the rest of the panel now, or rather let them introduce themselves. As I say, this webinar is a really close collaboration with a fantastic organisation, Action on Postpartum Psychosis, that we in Cardiff have been involved with for a long time. I'm delighted to have Sally Wilson on the webinar today. Sally, do you want to introduce yourself and maybe even more importantly, just say something about this great organisation, APP?
Yes, thank you, Ian, and welcome everyone. So my name is Sally. I'm the National Training and Research Coordinator for Action on Postpartum Psychosis, or APP. So APP is the UK national charity that supports women and families affected by postpartum psychosis. So it's a collaboration between academics, clinicians, and women and families with lived experience. It's hosted by the Institute for Mental Health at the University of Birmingham and supported by the NCMH at Cardiff University. So the charity offers peer support, lots of information and resources, health professional training, raises awareness and campaigns for better services for women and families. So just to mention today that there might be some topics that we're discussing that might be hard for some people. So please do feel free to step away if you need to. And the APP are here for any peer support or anything that you need from us as well. So I'll hand you back over to Ian. Thank you. Excellent.
Thank you very much for that, Sally. And then the third member of our panel in person today, and I'll come on to that in a second, is the very wonderful Professor Arianna di Florio, who's really been a major driver and a key part in the postpartum psychosis research that we've been involved with in Cardiff for many years. So Arianna, do you want to just introduce yourself?
Thank you, Ian. Thank you, Sally. Thank you, APP and the Perinatal Mental Health Partnership for organizing today. This is great to be here. As Ian said, my name is Arianna di Florio. I'm Professor of Psychiatry at Cardiff University, where I lead the Reproductive Mental Health Clinical and Research Program.
Excellent. So that's the team that you've got in person. Now, we were to have another woman with lived experience, Zebunisa, who unfortunately couldn't join us live, but myself and Sally thought we'd catch up with Zebi earlier in the week and record a discussion of Sally and Zebi's kind of experience, their lived experience of this condition. And we're going to play that now, if that's okay, Kat. So my name is Ian Jones. I'm a professor of psychiatry and I'm director of the National Centre for Mental Health. And one of the great things in my career has been to work closely with the charity Action on Postpartum Psychosis, APP, and I'm absolutely delighted we're joined today by two women from this fantastic organisation, Sally and Zebi. I'm going to just ask them to introduce themselves to us briefly. Sally, should we start with you?
Yeah, hi Ian. So my name's Sally and I work for Action on Postpartum Psychosis. So I'm the National Training and Research Coordinator. So I help to train health professionals in postpartum psychosis and involved in research as well. And I had postpartum psychosis in 2015. So.
Excellent, thank you very much, Sally. And Zebi, can you introduce yourself?
Hi, my name is Zebunisa. I'm also known as Zebi. I had postpartum psychosis in July, so it's been about 10 months since I had postpartum psychosis, and that's how I got involved with APP. I saw their brochure and I just wanted to really get involved with APP, and after looking into it, I wanted to volunteer and help out.
Fantastic, Zebi. It's great to have you both with us. I'm going to kick off with a question for Zebi. Zebi, can you tell us a little bit about your experience of PP?
Yeah, no problem. So I gave birth in July, and from day 5 to day 10, I went through a range of symptoms. I had racing thoughts. I was having delusions. I was having hallucinations. I was severely sleep deprived, and you could say my behavior was bizarre. My behavior was 10 times my normal personality. So I am generally I am a good communicator. I'm a good negotiator. So when it came to being ill, I was being over communicative. I think I was sending around 200 texts within 10 minutes to various people, and I just wasn't going to sleep. I just wanted to communicate all the time, and I was doing behaviors like, at one point I was very thirsty, so I ended up chucking a whole jug of water all over myself, just because I just didn't know what I was doing at all. And like the other day, my husband said to me, by the time you admitted in an MBU, you were completely gone. You weren't with it. And that was day 10 of having my baby. And thankfully, we got admitted to MBU. And it took me some time to recover, but I'll go into that later. It took me some time to recover, but it took me around 4 months to recover. And after that, I'm enjoying spreading awareness of postpartum psychosis, because I don't think there's enough awareness of postpartum psychosis.
So Zebi, on that point, was it a condition that you were aware of? Did you know about postpartum psychosis before you had the illness?
Not at all. So I have studied psychology. I've done a degree and a master's, and I've worked in the mental health sector as well. And I know about a lot of mental health illnesses. But when it came to maternal mental health illnesses, I knew about depression because that's talked about quite a lot. People go through baby blues, they go through depression, but postpartum psychosis was something that I didn't know about. So when it came to me being ill, I was in the research mode. I was trying to figure out, what do I have? And because I had never heard of postpartum psychosis, I just assumed it's bipolar disorder. So I was going around saying I've got bipolar disorder because I had highs and lows. I was going through a lot of highs and I was going through a lot of lows while being ill. And eventually I did find out that it was postpartum psychosis. I was a bit more relieved. And I just thought, I'm going to be working with this organization, APP, to help other women, because I can imagine if you've not heard about it before, it can be a bit confusing. And it was very, very confusing for myself. That's
fantastic. That close link and relationship with bipolar disorder is something that I'm sure we'll come on to and cover later today. Let me just ask you a little bit about that episode then. So when, after having your baby, was it a little boy that you had, did you say? Yeah. Yeah, I had a little boy, yeah. After having your little boy, when did you first become ill, do you think? Well, my husband says it a bit earlier, but I'd say around day 4, day 5. So it was really early in that postpartum period. And Zebi, can I just ask you, had you had any experience of significant mental health problems in the past, or is this the first time that you'd become unwell? So this was the first time I've ever experienced any mental illness. So when it came to me being ill, my family didn't understand this illness. And I had to get sectioned as well because I was extremely ill. And my family still didn't understand the extent to me being that ill. They were wondering, what is sectioned? What is postpartum psychosis? Is it something mild? Because I was extremely ill, but I was displaying intellect as well because I knew about psychology. So I was switched on, but I didn't know how ill I was. So I was doing behaviors that were quite erratic and bizarre. But then when I was speaking to the services, I was quite switched on with my knowledge about mental health and psychology. So when they saw me for the short interval,
whoever saw me for a short interval didn't realize how ill I was.
But it sounds like you got the help that you needed. You got into the mother and baby unit. Was that helpful? Did that help you in your recovery, do you think, getting that admission?
Definitely. I feel like these mother and baby units are fantastic. They specialize in the care for the mother and the baby, and they really do help mothers out. I think if that didn't exist, I probably would have taken a lot longer to recover. Initially, they did want to put me in a psychiatric unit, and I was fighting to go to somewhere joint with my baby. And I did go to the mother and baby unit, and I feel like the resources they have there, the staff they have there, they have all the skills to help a mum get through anything and everything. Whether a mum has support or doesn't have support, they do really help that mum out.
So one of the fantastic messages to come from your story, Zebby, I think, is that it sounds like you were really unwell, you were really seriously ill, but you've done brilliantly. It sounds like you've recovered well and are doing well. How are you now? What you say? It's how many months on from the baby being born?
So he's now turning 10 months next week.
Wow.
And yeah, I'm going back to work as well next week as well.
Fantastic. So there's a really important message there, isn't it, about how this illness can be really serious and severe, but that women do really well when they get the right treatment and they recover. Fantastic. Zebby, that's brilliant. I'm sure we'll come back with some more questions in a minute, but let's move over to Sally now. So Sally, what was your experience? What were there similarities or differences to the experiences that Zebby's described?
Yeah, thank you. And thank you, Zebby, for sharing that. I think there's always similarities between women that have been through postpartum psychosis. So some of the symptoms that Zebby was describing are very similar, but my kind of journey to recovery was probably a little bit different. So I'll talk a little bit about that. So I had my daughter in 2015, and I became quite ill quite quickly. So basically I had a general anaesthetic, an emergency C-section. And then as I came round, I was just very confused. I couldn't really make sense of time. I knew that something just wasn't quite right, but I couldn't really articulate it or tell people what was going on. So it's pretty much as soon as I woke up from the general anaesthetic after giving birth to her that something wasn't quite right. And then over those few days, I was on the postnatal ward and started to kind of hear and see things that weren't really there. So kind of shadows on the wall and kind of hearing things really loudly in my head. And then eventually I started to hear and see things that weren't really there. And I kind of had what we call a kind of a psychotic episode on the postnatal ward, really. So I kind of collapsed from the outside. It probably just looked like I was exhausted from everything that had been going on. But in my mind, something very different had happened. And I kind of came round and was living in this kind of altered reality. And in my mind, I was living in some kind of afterlife and being punished for having done something to my daughter. So really scary at the time, really frightening, trying to work out what was going on. And at that point, I was admitted to a general psychiatric unit. So we didn't have any mother and baby units in Wales when I was poorly. So I was separated from my daughter for a couple of weeks and treated in the general psychiatric unit, and then eventually discharged into the community. I was quite poorly for quite a long time. So I had the psychotic symptoms alongside severe depression. I'd probably say about 9 or 10 months really, so still quite poorly. So if you think where Zebby is now in her kind of recovery journey, I was still kind of trying to access the right treatment for me. And then we came across APP, who signposted us to a secondary psychiatry service. And just because I was still quite poorly, it was suggested that I try ECT, or electroconvulsive therapy. So I had ECT as an outpatient. I had 10 sessions. And for me, that was kind of the turning point in my journey, really. So it really did save my life at that time. It took a while to recover. The treatment itself had some, memory issues, and probably from the illness as well, dealing with all the kind of shock of everything that had happened in terms of, having a severe mental illness and kind of coming back into the room and realizing what had happened. And building back up my confidence and working through all the kind of horrible thoughts I had when I was poorly. But I did that with the help of APP and a clinical psychologist and lots of kind of family and friends support, really. So yeah, that's my kind of story in brief.
I think that's really fascinating, actually, because clearly there were some similarities between the experiences, but clearly some differences as well. And I think that really underlines the important point that all women's experiences are different. Your experience of PP was of a severe illness in both your cases. Zebi, perhaps you had, you weren't sleeping and you were sending loads of texts and you were much higher in mood. Sally, it seems to me that your mood was much lower and more depressed. Just pick up, because Sally, you mentioned about the ECT treatment that really helped you. So we didn't talk much about that. What treatment did you get for the illness when you were on the mother and baby unit? What was kind of the effect, the important parts of treatment that helped you get well?
So for me, they gave me medication,
Okay.
although I was resistant to have medication. So it took me some time to accept it. And then we also had like therapeutic activities over there.
Great.
So those were quite good, because if you try any therapeutic activity, for instance, clay making or painting or coloring, these sort of activities are quite good for mums. They keep them at peace. They control when you're feeling like your thoughts are all over the place, when you're concentrating on activity, it just makes you feel that little bit better. So they were trying to engage me in a lot of activities, and I absolutely loved it.
So that's another really important point to bring out of your experiences, isn't it? Is that the wide variety of ways in which women need to be helped, really from medication, which we know for postpartum psychosis can be really important treatment, for ECT even, which we know can really help women recover, but those other factors as well, to being admitted to hospital, to given that therapy. What some work done by EPP a few years ago, what I find really interesting was what women felt that they didn't get so that wasn't done so well, was that help to come to terms, that longer term psychological help. So I'm going to ask you that question now, actually, following up from that, what is it you think that we need to do better as in helping women with PP, both from your personal experience, but also from the work that you've done through APP with other women? Maybe Sally, should we come to you first for that?
Yeah, I guess you've just talked a little bit, Ian, about that help coming to terms with things. So one of the massive part of my recovery was coming to terms with everything that happened, and the way I did that was partly through psychological help, so clinical psychologists, but also meeting other women and families that had been through it as well. And I ended up having a peer supporter where I could ask her, she'd been through a similar experience to me 10 years before, and I could ask her anything really in relation to postpartum psychosis. And for me, that gave me kind of hope that things weren't always going to be that way. So that was a massive part of my recovery. And I guess it's making sure that people understand that recovery process in postpartum psychosis, that it can take a long time to come to terms with anything, with things that have happened. So creating that awareness, raising that awareness, educating health professionals who support women and families in the perinatal period. So, it's not necessarily just in that 1 or 2 years, that potentially there's recovery after that, and things that can affect things in the future as well. So I guess in terms of helping women, it's creating that awareness and educating people that support women and families. So
have you got anything to add to that? Was that similar experiences of what you think that we need to do better?
Definitely. I think obviously having more research in the area would be great, because then that can help raise awareness. I think also maybe, obviously I'm still early in my journey, sure. So I'm not sure if they do follow up these women who have had postpartum psychosis, just so they get that reassurance. And I feel like I'm quite early, so I don't know if they do follow up. I don't know if these services do follow up. Do they follow up these women, and do they check on them to see have they recovered? Because I spoke to a few ladies, and they do feel like they are likely to relapse, and some women have relapsed. So I think there just needs to be some sort of support. So for instance, I got discharged last week officially from the service. Great. And I'm just wondering, do they do a follow-up? will they follow up me later, or is that it? Is the support finished now?
So that's a really important point, isn't it? I guess, you know, from both what Sally and yourself, Sebi, have said, yeah, it feels like it's not just helping women get over that initial phase of the postpartum psychosis, but giving them that help and support ongoing, which is important for services, but also a vital role in that can be played by the charity, the third sector. So my next question really is, I know that you've both benefited from the help of APP and also are giving something back now and are involved in working with APP. What is it that you think APP can offer women in that journey?
I'm slightly biased, I think, because I feel like APP actually saved my life. So yeah, I am slightly biased.
That's a massive statement, actually, isn't it? I'm sure you're not wrong, and I'm sure that it is that important to many women, you know. And it's been, you know, but you really think you may not have been here if it wasn't for the help of APP.
Yeah, definitely, because just at the time there weren't specialist services where I lived, and that, you know, things have changed a lot since I was poorly, and there are specialist services now. So I you know, it took a lot for me to try and find that treatment that I really needed, and without APP signposting to specialist services, you know, I may not have got that treatment as quickly as I did. But then also the peer support for me was a bit of a lifeline. Right. You know, whilst I was ill, I was able to talk to someone that had been through it before and just offer me that hope and just to keep going, and that you won't always feel that way and that you will get better. So again, for me, you know, it just gave me that hope that things weren't always going to be that way. So yeah, I really do feel that, you know, working together with health professionals, the APP did save my life at the time. So
what a fantastic statement to make, and really underlines the fantastic and the important work that APP does. So we're going to tie things up in a second, but just last question to you both, and that's what is there something that you wish you knew about PP that you didn't know when you first became ill, that you wish you did? Sally, should we put that question to you first?
Yeah, I guess lots. I wish I'd known a lot, really. I know so much more now than I did when I was ill. So I'd never heard of postpartum psychosis before. When I was ill, I went back to look at the little booklet that we get for pregnancy to see if it was in there, and there was a little paragraph in there about it, because I just didn't believe that it was an actual illness. So I guess, yeah, having known about it before would have been really helpful. So knowing the signs and symptoms, knowing how serious things were at the time, and that I should have probably been in a mother and baby unit at the time. I guess that recovery can take a while in some people as well. So, and it's not always linear. So you have this sort of, you know, it's not you suddenly feel better. It can take time. And that, I guess, for me, I spent a lot of time trying to work out why it happened to me. And I guess knowing that it wasn't my fault, and that I wasn't always going to feel that way, and yeah, that I was ill at the time, and it wasn't my fault, really. So
I think that last point is really important, isn't it? Because many women I talk to try and find the reason why it happened, and often, you know, there isn't a reason. It's, you know, so I think having that acceptance that it's, you know, just one of those things, you know. But actually, the other point that came out very strongly from what you said to Sally is the kind of hope that that women do really well and can recover, yeah, become great mothers, and yeah, and as you both have illustrate so beautifully, you know, can do fantastically well, you know, you're following this severe illness. Zebi, that was great from Sally. Is anything you want to add to that?
Yeah, like Sally, I just wish I knew that postpartum psychosis existed, so then I could have mentally prepared myself for potentially having postpartum psychosis. I felt like once I had it, and I've recovered now, when I went through these classes, the antenatal classes, there wasn't much, they weren't raising awareness of recovery. So when you recover, you go through a lot of things. Your body changes, your hormones, and also you can get all these these illnesses like depression, postpartum psychosis, I definitely think there's a gap there that they need to help raise awareness of postpartum psychosis and all these other illnesses that a mum can potentially get. So I just wish I knew that it existed, so I could have potentially looked out for it or known about it and then help myself recover.
Well, you're both doing absolutely amazing work with APP in making that change, in spreading that word and reducing the stigma and really, getting the message out there. So huge thanks for the work that you do generally, and huge thanks for talking to us today. So Zebi, Sally, thank you very much.
Thank you. Thanks.
So without further ado, it's been fantastic. And thanks again to Zebi and Sally for sharing their lived experience. I'm going to hand over now to a fantastic colleague, Ariana, who's going to tell you a little bit about the work that we've done in postpartum psychosis research and the plans that we have for the future. So thank you, Ariana.
Thank you, Ian. Let's see if my computer behaves. Can you see my screen?
Yep, all good, Ariana.
Fantastic. Thank you, Kat. So in the next 15 minutes or so, I'm going to talk to you about our research on postpartum psychosis and about its relevance for people with lived experience. We've been focusing in our research group on two questions in particular. The first one is, who is at risk of postpartum psychosis? In other words, can we more accurately identify women at risk of postpartum psychosis and therefore provide a better risk assessment and management of the condition? The second question is, what are the causes of postpartum psychosis? However, postpartum psychosis is a complex disease, so probably this question is better framed in terms of probability rather than absolute cause-effect terms. So we do ask, what mechanisms do make some people more likely than others to develop postpartum psychosis? This second question is not just intellectual curiosity, but it has long-term implications for the way we manage postpartum psychosis and can lead to the discovery of new treatments. First, though, I wanted to make sure that you and I share the meaning of three complex and sometimes controversial terms that I will use during my talk: mania, postpartum psychosis, and bipolar disorder. I think Zebi and Sally have already described these terms in the best way possible by sharing with us their experience. Here I provide some formal definition. So mania is a state of abnormally high energy with high or irritable mood, sometimes with psychotic symptoms such as delusions and hallucinations. Postpartum psychosis is a condition characterized by mania or psychosis that occurs within a few weeks after giving birth. Bipolar disorder is a mental disorder characterized by episodes of mania, and this episode can be very severe, with very severe mania and sometimes psychosis, and we call these bipolar 1 disorder or bipolar type 1 disorder. And when the episodes of mania are less severe without psychosis, and there are also in the life of the person episodes of depression, we talk about bipolar 2 disorder or bipolar type 2 disorder. So the first question is, who's at risk of postpartum psychosis? Well, we know that in the general population of people giving birth, about 1 or 2 in 1,000 of them develops postpartum psychosis. So there is a tiny, tiny risk in the general population of having postpartum psychosis. We asked, so can we do any better? Is this 1 in 1,000 for all women? I don't know why my computer, I'm sorry, is keeping doing this. Sorry about this. Is it 1 in 1,000 for all women, or is there a group of women who are more at risk than others? So our research group in Cardiff, in collaboration with the University of Worcester and a massive help from Bipolar UK and Action on Postpartum Psychosis, has created a larger research network of people with lived experience of bipolar disorder and postpartum psychosis in the world, with over 7,000 people taking part. Using data from this very large network, we have calculated how many women with a diagnosis of bipolar disorder, do suffer from postpartum psychosis. We found that whilst in the general population, as I said, the rates are about 1 or 2 per 1,000 deliveries, for women with bipolar 1 disorder, so women with history of severe mania, the rates are 1 in 5 or 20%. This means that women with a diagnosis of bipolar disorder are over 100 times more at risk of developing postpartum psychosis than the general population. When we explore the data in detail, we also find that women with bipolar disorder not only have a high risk of postpartum psychosis, but are also at high risk of postpartum depression. The risk, so low mood without psychosis. The risk is particularly high for women with bipolar 2 disorder, so the type of bipolar disorder characterized by episodes of depression and less severe episodes of mania. This is the first piece of robust evidence detailing the risks of postpartum depression in bipolar disorder and the risks for women with bipolar 2 disorder in particular. When we compare the rates of postpartum psychosis and depression after childbirth, so postpartum psychosis and postpartum depression, to those of postpartum psychosis and depression after miscarriage and termination, we found that while the risk of depression is around 1 in 5 for all pregnancy outcomes, the risk of psychosis is higher after childbirth compared to miscarriage and termination. So now we have established that the average woman with bipolar 2 disorder has a 1 in 5 chance of suffering from postpartum psychosis. But can we do even better? Can we be even more specific? In a subsequent study, we have established 3 simple evidence-based questions that can be asked in the clinic and can help personalize the risk of postpartum psychosis and postpartum depression in women with bipolar disorder even further. So the questions are around the presence and the severity of manic episodes, postpartum psychosis, and postpartum depression. So 2 examples here of 2 risk profiles. Of 2 women, both these 2 women, the risk profile on the left and the right, both have a diagnosis of bipolar 1 disorder, so has history of severe mania. However, the one on the left has a history also of postpartum psychosis, while the one on the right doesn't have any history of postpartum psychosis, but does have a history of postpartum depression. As you can see, a history of postpartum psychosis means that this woman, the woman on the left, is a very high risk, over 40%, so 2 in 5, not 1 in 5, of developing postpartum psychosis. However, the woman on the right has never had postpartum psychosis before, but had postpartum depression, is a less than 10% risk of having affective psychosis. Is, however, a very high risk, 1 in 2, of developing postpartum depression. I have not put here all possible profiles. You can find them in a publication cited here, published in the British Journal of Psychiatry. Now that we have established the risk, we want to understand the mechanism that cause postpartum psychosis. Based on previous research, including some by our group, we believe that the biology here plays an important role. We therefore focused our research on the biology and in particular on genetics. You might say, why genetics? Well, DNA is fixed at birth and is the same in all cells. So the information we get does not change with time and is the same whatever tissue we use. This makes DNA collection as easy as spitting, much less painful and annoying than a COVID test, for example. Building on the exceptional world-leading resources and expertise of our center and the BDRN, we have conducted the largest genetic study of postpartum psychosis to date. We hear a lot about DNA these days, but how does DNA work? At the Wellcome Collection in London, they used to display these books. If you look at their content, you will discover that they are written using just 4 letters. These letters are the building blocks of our genetic code, the DNA. This whole library here reports the code for just one person. Now, the code is almost the same for all of us. What makes us unique from a genetic perspective is less than 1% of the code. We also know that a significant part of our risk of developing common disorders, such as psychiatric disorders, is due to many spelling variations or mistakes that taken singularly don't have any big effect, but it is their accumulation that increases our risk of disease. This is a very important point, exploited in many areas of modern Western medicine, way beyond what we are discussing today. As many of you may well encounter this concept again in your own medical care in the future, I will try to explain them to you using the codebook metaphor. Let's say you're interested in the likelihood that a person is a native British speaker. If you have a group of individuals and each individual has written a book, the distribution of number of spelling mistakes made will follow a bell shape like this. Most individuals will make an average number of mistakes. I don't know if you can see my pointer, but it's here. While only very few of them will not make no spelling mistakes here, or on the opposite, a lot of spelling mistakes. The more spelling mistakes you make, the less likely you are to be a native speaker. Now, Ian will make some spelling mistakes, however, not many. By reading his book, you will conclude that Ian is quite likely a native speaker. Now, the same book written by me, in this case, there will be many mistakes, many more than the population average, and you will conclude that I'm probably not a native speaker. Going back to DNA, the graph is similar. Here in gray, there's a risk, for example, of having a disorder such as bipolar disorder that increases with the number of spelling mistakes that here we call polygenic risk scores. Now I'm going to show you how to apply this principle to postpartum psychosis and how genetics can help address long-standing controversies. I've told you about postpartum psychosis and bipolar disorder. Postpartum psychosis is currently not recognized by the official diagnostic systems at the detriment of women. Women who suffer from postpartum psychosis usually receive a label of bipolar disorder, regardless of their lifetime history. Let's take 3 women here. They all have a label of bipolar disorder according to official diagnostic systems. However, if we follow them up from their own birth to 6 weeks after giving birth, we found that they have different life trajectories. The first woman on the top, despite having bipolar disorder, does not become ill after giving birth. The second woman, instead in the middle, becomes ill also after giving birth, this woman here. And the third woman on the bottom has never had bipolar disorder until she gets pregnant, she gives birth, and she develops postpartum psychosis. So currently, according to the current diagnostic system, these 3 women are exactly the same. They all have the same label. We asked therefore ourselves, can genetics help distinguish these 3 groups? So we calculated our bell-shaped distribution for various polygenic scores for the 3 groups of women and for female controls in the general populations. Here on the top, you see how the graphs look in real life if you do the calculations. And I know this can be quite off-putting and scary mathematics, but the message is actually quite simple. From a genetic point of view, what matters here is whether the woman has a history of bipolar disorder before the episode of postpartum psychosis. So like in the first 2 cases here, whether you have postpartum psychosis after childbirth is less important compared to having a history of bipolar disorder before childbirth. These 2 groups are, from a genetic perspective, absolutely indistinguishable. While women who do get the first episode of bipolar disorder postpartum psychosis after childbirth out of the blue, they are similar to the 2 groups above, but they're not identical. Actually, there are differences between these groups. It's quite complicated, but the take-home message is that genetics can help us personalize the, the biology of the different women that from the outside would look more or less the same. Clinical wisdom and research had already suggested that it's useful to make a similar distinction. Our study, however, provides the first evidence of the biological validity of postpartum psychosis, and it really finds this method to study the controversial relationship between bipolar disorder and postpartum psychosis, which is a controversy that's been ongoing for over 150 years. And this type of studies are necessary to go towards the official acknowledgement of postpartum psychosis by diagnostic systems, with important implications for research and clinical practice. An important aspect of medical research is diversity and the inclusion of people of non-European backgrounds. We have argued that the scientific debate on diversity, especially in genetics, should consider the impact of culture on the risk of disease and its manifestations. For example, without going outside Western culture, we have found in our research that postpartum depression differs significantly between Europe and the United States. If differences are so evident already when we consider only Western culture, the impact is even more striking when comparisons include non-Western cultures. We have therefore set up an international consortium involving women with lived experience and stakeholders from different geographical, linguistic, and socioeconomic backgrounds worldwide to develop culturally sensitive questionnaires and research approaches. These are some initial results from a qualitative study led by wonderful Jessica Young in our group in Cardiff. Jess, with the help of colleagues in Cardiff, in Malawi, and in India, has worked with people with lived experience, including family and friends of people with history of postpartum psychosis and healthcare professionals, to explore their understanding of postpartum psychosis and their priorities. This was a fantastic cross-cultural effort, and for the first time, it gave the opportunity for an active role to women with postpartum psychosis living in non-Western countries. In this graph, you see the topics discussed, which include disease presentation, the importance of lack of importance of terminology, treatment, service provisions, and barriers. The results are extremely rich, as you can see. An aspect, just as an example, which I found quite humbling, was the different emphasis around labels that is given across cultures. This innovative system of doing research will allow clinical and biological research to be impactful beyond the Western world, hopefully providing appropriate care for all women who need it. To conclude, our research thus far has led to some findings that have already impacted clinical practice. Not all women have the same risk of postpartum psychosis. The most robust risk factor is a history of bipolar disorder. However, not all women with bipolar disorder have the same risk profile, and not all women with postpartum psychosis are genetically the same. More research is needed to understand how to provide tailor-made prevention and treatment strategies. And for this reason, we are launching today the MAM survey, which is a survey on perinatal mental health, specifically in postpartum psychosis, with the aim of tailoring prognosis and management even further. And we invite women with lived experience to take part. If you wish to check this out, this is the link to the survey with further information about it. Thank you so much for your attention. I conclude by thanking my colleagues in Cardiff and beyond, our funding partners, and of course, Bipolar UK and APP. Thank you.
Excellent. Thank you very much, Ariana, for that wonderful summary of the work that we've been doing in the group in Cardiff and the need and importance of continuing that. And really, I think one of the things that's really come through from that talk is that how much we rely on women with lived experiences of PP to be part of this collaboration along with academics and researchers and clinicians in order to help us really get where we need to be. We need to understand more about this condition in order that we can develop better treatments, better way of predicting women at risk, and really ways in which we can help women who suffer. we've got a lot, 10 minutes or so before we finish, and I'll make sure we finish the webinar on time. And we've had some fantastic questions in on the Q&A tab already. So if people could add any questions they've got. I'm sure we're not going to be able to take all of them today, but we will. Kat, I hope that we'll be able to kind of answer them in a written form as well, and post that up somewhere, and we'll let people know where they can access that. The other thing I think it's really important to make is that we will be making a recording of the webinar today available. So if people want to kind of share it more widely, go back and listen to anything that they want to hear again, we'll be sending a link out, Kat, to everybody that's registered. So that's brilliant. So I'm going to kick off with the first question to Sally, actually, which is one of the reasons that we wanted to have the session today was to talk about the need for research in PP. From the work that you've done with APP, Sally, and from all the input that women give to that organisation, what do you think are the key themes or questions or issues that we need to address in research when it comes to PP?
Thank you, Ian. I'll try and keep it brief because I'm sure there's lots of different areas. I guess we've already talked a little bit about it today in terms of looking at that long-term recovery. So APP have done a lot of work already on the kind of care and outcomes and recovery from postpartum psychosis. So we launched a survey just before Christmas, the APP 2021 survey, which is now closed, and that's looking at the kind of care and recovery over the last 10 years, and importantly, the kind of comparing mother and baby unit care to other forms of care during postpartum psychosis. So there is that work out there already, but I think there's still unanswered questions, particularly when we talk to women and families, looking at more long-term, what are the instances of mood disorders in the future, maybe looking around the kind of menopause and perimenopause, what happens there. I don't know if Ariana or Ian wants to expand in terms of what we don't know a lot yet, but I'm sure that that's something that people will be looking at in the future.
Ariana, do you want to pick up on that? I think you very clearly in your talk highlighted those two research questions that we're trying to answer with the research program. Is there anything from what Sally said that you'd like to add to?
Sally mentioned menopause. It's always an argument that it's not that it's becoming popular, but actually it's not much researched. And I think because postpartum psychosis is so rare, we need really big numbers to see if there is an association between the two. There is a case series that APP with Ian and other researchers have published years ago, suggesting an association between postpartum psychosis and relapses at the time of the perimenopause. But actually, there is no systematic study on this, and this is also something we hope to look at, because it's important to consider things in a life trajectories and perhaps identify specific groups of women, because it's my strong belief that actually not all postpartum psychosis episodes are the same, not all women are the same. We tend to think about on averages. I think we really need to change this approach and consider all women in their uniqueness.
One of the questions that came up there, Sally, in your list of issues, and it's an issue that somebody asked about in the Q&A tab as well, is the risk for a woman who's had PP, who's recovered very well, maybe had PP episode a number of years ago. What's the risk of further episodes, related to childbirth and other times? Ariana, do you want to answer that? I know that work that you've been involved with has addressed those issues.
Of course, we'll provide a number, because this is what we can do now in very few minutes, but actually there is a lot of complexity and uncertainty around this. So I would actually prefer to, probably the most sensible answer is that the risk is higher than the average woman with bipolar disorder if you had an episode of postpartum psychosis before. And I would say it's around 40%, but how confident I am of that estimate is a different idea. It's not exactly 40%. It's much higher than that, and definitely much higher than a woman with bipolar disorder that had a first pregnancy and the first pregnancy went well. In that case, it's lower than a woman that had a first pregnancy that did not go that well and ended up in an episode of postpartum psychosis. Is it clear?
Yeah, so I think added to that, I think the important message is that if you've had an episode of postpartum psychosis, definitely future pregnancies, you have a high risk of recurrence, and it's really important that everybody involved in your care knows about that previous episode and can help you reduce, minimize that risk as much as possible. But there's also a risk of having episodes not related to childbirth, and probably on average about 50% of women who have a postpartum psychosis will go on to have further episodes of illness, not related to childbirth. So it's definitely something that we need to be aware of. Going to come to another question now that's a really important one, I think, and I think it comes back to one of the things that we were talking about with yourself and Zebi, Sally, about people looking for the reasons that they experience PP. It's a very short question. Is PP caused due to childhood trauma? I know, Ariana, we've published on this in the group. So should we go to you first and then see if Sally has anything to add?
Well, again, when we talk about these things, we do not need to think black and white. There are women that have had childhood trauma that will go on and develop postpartum psychosis, sadly. And so there are women that without that history, that don't develop, that with that history that don't develop postpartum psychosis. It's also sometimes, I think, underestimates how many women unfortunately suffer from trauma in their life. So it's something really common, unfortunately, more common than what we usually think or hope. That said, statistically, and there are lies, but lies on statistics. However, if we think quantitatively, there doesn't seem to be a strong association with postpartum psychosis. There is, however, an association with postpartum depression, we think.
And I think that's a really important point, isn't it? Is that the research that's there suggests that while trauma can be obviously important for mental health, it doesn't seem to be something that's really particularly linked with postpartum psychosis. Sally, is that something that chimes true from the women that contact APP? Is this a question that comes up?
Yeah, definitely. I think it relates back to what we were talking about, that trying to work out why it's happened. A lot of women will go back and sort of analyse their childhood and what happened during the illness and post-illness and try to look for those reasons of why it happened, which is totally understandable. It's something I did as well, trying to really work out why it happened. And I guess it relates back to those causes of postpartum psychosis, which is what we know a lot more about than we did used to know sort of 10, 20 years ago, which is really positive. I think women and families still look for that reason of why it happened and trying to work out exactly why it happened. And we don't always know the answer, unfortunately. But yeah, it's definitely something that comes up a lot in terms of why me? Is it something related to what happened in the past, I think. So.
Thanks, Sally. I'm trying to get to a few more questions before we finish. Is rage, mum rage, I'm assuming that question's coming from America with the use of the word mum there, mom, I should say. Is mum rage a symptom of PP psychosis? Ariana, is rage something that we see?
Rage is not in the textbooks, but I define rage, that is absolutely one symptom, like in terms of irritable mood.
Irritability is in the textbook.
More formally, more boringly in the textbook. However, I think when we talk about feelings, it's really difficult to use right terms, but definitely anger, if you want, these raging feelings can affect some women, not all women, and also not all women with rage do have postpartum psychosis. That is also very important to emphasize.
I think that last point's really important, isn't it? In of itself, it's not an indication of PP, but it can be part of the picture. Is that something you see, Sally, from the women contacting APP, that irritability or rage?
Yeah, we do a lot of. Yeah, a lot of women talk about rage and anger, but as Ariana has pointed out, that happens outside of postpartum psychosis as well. But it's very individual. It depends on the kind of nature of that woman's illness. So mine was much more depressive illness, and I did have some of that anger and rage as well that I would describe. Yeah. So
another question about recurrences and their relation to menstruation. I guess this was the relation to other kind of reproductive life events. The menopause is something that you highlighted, Sally, as a question that we need to address. I know, Ariana, it's really definitely under your research group's interest. Yeah, do you want to say something about the timing of recurrences and related to menstruation?
That, you know, like if we use intuition, that sounds really possible. As we see a lot of differences within postpartum issues, psychosis, depression, I think it's the same with the link with premenstrual dysphoric disorders and premenstrual symptoms that are their own world of complexity. What I would say is that I would think there might be a link, especially with depressive symptoms, you know, around the luteal phase, so before the menstruation, and probably postpartum depression. There is more evidence towards, you know, like that type of illness rather than for psychosis. Menstrual psychosis is really rare and, you know, a very controversial phenomenon. So it's difficult to say, and we definitely need more research. And actually our mom survey has questions also around menstruation and menopause. So we will be able, hopefully, to capture the risk of postpartum psychosis in relation to these other reproductive events.
Fantastic. I'm going to take one more question. And Sally, this is for you, because I think it really gives an opportunity to raise the important work that APP does again. But one of the attendees has asked what help is available for families for them to be able to support. I know this is something that APP takes really seriously.
Yeah, we have lots of resources on our website, which Kat has put a link into for partners and the wider family as well. We offer peer support for partners. Also, just recently before Christmas, we started our new grandparents peer support online. So that's parents of women or partners that are going through postpartum psychosis, because it really does affect the wider family. So that's where people can just talk about their experiences and support each other through those times together, really. So lots of information resources for the wider family as well from APP. So
excellent. So thank you for that. We're at 1 o'clock, so I'm going to bring this fantastic webinar to an end. Huge thanks to APP, huge thanks to NCMH and BDRN, huge thanks to my fellow panelists, to Zebi, who couldn't join us live, unfortunately, but to Sally from APP, and to Ariana. But big thanks actually to Kat, who's been in the background, who's sorted all this out for us. Thanks, Kat. Thanks to the Perinatal Mental Health Partnership for this fantastic week and for allowing us to be part of it. And just before we finish then, there's lots of links in the chat. We'll send links out again. We really do want as many women with postpartum psychosis to help us with this research program as we can. Kat's put the link up there, but don't worry, we'll send a link out by email to everybody that's registered. It's been fantastic. I think, I don't know what the maximum others saw, but I think we were up to 230 people watching live, and I know we've got another 300 or so who've registered who will kind of watch it later. We'll send out a link when that goes up. And the other thing just to say is there were some fantastic questions that we didn't get to. We'll answer them and kind of make those available as well in the next few weeks. So with that, we're thanking my fantastic panel again. Thank you all for attending, and we hope to see you all again soon.